Hey, everybody, I'm Patrick Varno. I'm the CEO of Emory Leadership Group, and I'm also the host of the podcast Learning from Leaders. And on today's episode, what I wanted to talk about is actually a study that was published last year. I do a lot of work in healthcare and working with teams, individuals, nurses, executives, physicians. And I would say over the last year or more, I've seen even more of an increase in talk around burnout and elevated levels of stress. And to me, what I wanted to talk about was actually a study that was put out by the Joint Commission. It was published, I believe, last January of 2020. And what I will do is I'll have the link to this study in the notes. I've got a copy of it right here. And what I'm going to do is just touch on first the abstract of this study, which really, for anybody that's familiar with clinical trials or studies, you know that in the beginning there's an abstract that gives you really just the high points of what the study's about, and it can be really valuable. And what I'm going to do is just touch on that so you get an idea on how this study was put together, what it looks at, what the results were in the conclusions of it, and then I'm going to talk about the behaviors that were identified in this trial so that you can get an idea based on your own institution, if it is healthcare. I would say many of these, even though this was done for healthcare, it's not just healthcare. This can sort of transcend to other industries as well. So the background of this, and as I said, forgive me because I want to be able to read this to you. It says disruptive and unprofessional behaviors occur frequently in healthcare and adversely affect patient care and healthcare worker job satisfaction. These behaviors have rarely been evaluated at a work setting level, and we do not fully understand how disruptive behaviors are associated with important metrics such as teamwork and safety climate, work-life balance, burnout, and depression. Now, in the work that I've done, and there are a number of studies that are out there that look at the impact that disruptive behaviors have on healthcare, especially from a standpoint of patient safety and mortality. So now we're talking about not just us not getting along, but the impact of this in terms of somebody's life. Now, can you imagine being in an ER and having to come out and tell a family member that, sorry, Mrs. Johnson, your husband died. It was because two of our staff members weren't getting along. And I know that sounds so absurd, but really at the core of it, that's what we're talking about, how disruptive behaviors really can impact not only teamwork, but more importantly, patient safety. So the objectives of this really was to look at what impact does this have? They started out with about 15 disruptive behaviors that they were going to evaluate. And once they did that, they whittled it down to about 6 based on what were the most prevalent responses. And under results, one or more of 6 disruptive behaviors that I'll talk about in a moment were reported. 97.8% of the respondents said, yes, we've seen that in the workplace settings that we're in. So the conclusions of this went on to say disruptive behaviors are common, measurable, and associated with safety culture and healthcare worker well-being. This concise disruptive behavior scale affords researchers a new, valid, and actionable tool to assess disruptive behaviors. And what I think is important here is this, to me, provides an opportunity for organizations to use this tool to assess their own organizations. How are we doing? Which one or more of these disruptive behaviors are we probably experiencing in our own setting? And what I'd like to do is I'll go through and talk about each one of these 6 and also talk about some behaviors that I use and some tools that I use to help address this in a way that this doesn't become an issue. We're able to manage this. And I think that's so important here. So the way that the survey was set up, and there were, I think, about 7,800 participants that responded to this survey. It had about an 86% response rate, which that's pretty good. To me, when you look at an 86 response rate, at least in my humble opinion, it speaks to people wanting to be able to talk about this subject, how important this is, that many people are willing to take their time to fill this thing out. When the question was asked, it was, in this clinical area, one or more people do this. And then you had to check off basically on a 5-point scale how frequently you saw it, or you could say you didn't see it at all. Now, as I mentioned, almost 98% of those that responded say, yeah, we see this in our own facility. So the first two to me sort of go hand in hand. The first one, most prevalent, was the person turns their back on me when I'm speaking to them, or they've witnessed that. Now, when that happens, right, to me, that is a clear sign of a behavior, a lack of a behavior around listening. And it's about respect at that point too, right? Who wants to be having a conversation with somebody and right, in the middle of that conversation or before it's ended, the person that you're having that conversation with just sort of turns their back to you and walks away. So that was the first one that was identified out of these six as the most impactful as it related to all of these other things, teamwork, depression, disruptive behaviors, um, all of those things. So the next one was the person hangs up the phone before the conversation is over. So that's sort of the distanced version of turning their back on me when we're face to face. Again, to me, that's a clear example of a behavior that's absent in this organization or between these individuals, which is around listening. For one, we know how important that behavior is. And it's something that I talk about quite frequently in the model that I use called cable. So it's the L in that model around developing better relationships is about listening. We need that. And when we don't have that, we create this kind of environment. The third disruptive behavior was around bullying. And we've certainly heard a lot about bullying today, but we see how important that is, right? Bullying in this environment, right, creates either disengagement for some where they retreat, or it could create engagement of disruptive behaviors themselves. I get bullied, and then what do? I go out and treat somebody else poorly. I sort of have that contagion of doing that to somebody else. So that was the third one. The fourth one was trying to publicly humiliate others. And again, I've seen and heard of this quite often, especially over the last year. I think there's been so much that's gone on over the last year that we really have underappreciated the environment that we've been in. And I don't mean it just from a standpoint of staffing and struggling with patient loads and that type of stuff. I'm talking about the personal aspects that people have been impacted by. That a lot of the outlets, releases that people might have had a year and a half ago, those went away. And an example of that, one of the offices that I was talking to, one of the directors said, it feels like Groundhog Day here. That every day is the same, whereas people don't have the outlets that they used to have, where if I was frustrated at work, maybe I'd meet with coworkers after work for a drink and we'd sort of blow off steam and talk about what was going on, and then it was okay. Right? Or maybe it was sporting events, or it was my kids' events that I would go to. And that was an outlet for me, or, a number of other things, but those all sort of went away, right? We became more isolated with lockdowns and other pressures that came on. If you had kids, you're wondering remotely, are they learning? Especially if I can't be there to make sure that they're online and getting all their information. That can put a lot of stress on me. Maybe I've got parents that I'm concerned about their wealth or their health and well-being. And that's playing into my role. Maybe I have a spouse or significant other or somebody else that is at risk of losing their job. And I'm thinking financially, what impact this is going to have. All of those things come into play as it relates to how people might show up at work. And that can show up in different ways, in different disruptive behaviors. Trying to publicly humiliate people. We know how damaging that can be, right? And is that more at times where the person doesn't feel good about themselves? So what do? Try and knock somebody else down. The next one, which I would say if this was started in 2008, if we were to do this again today, more recently, even though the study was published a year ago, I'm guessing this one might move up the list. So make comments to sexual, racial, religious, or other type of comments around those that are disrespectful. And we know the impact that that can have, right, on an organization. The last one, which I would guess shows up least frequently and is probably the easiest to address quickly, is actual physical aggression towards somebody else. That was the sixth disruptive behavior that was identified in this comprehensive piece of research. Now, when we look at those, I will often go back and a couple things that I work from in this setting is one around emotional intelligence, helping people to identify and understand what is emotional intelligence, why is it important. I'm certainly not one of these disciples of emotional intelligence that thinks that it's the be all end all, that this is all you need. But to me, it's an important component. When people understand how to perceive, understand, and manage either their own emotions or somebody else, it can be really important. And self-awareness is the first one. I do a lot of work or exercises around helping people with self-awareness to look at what are their values. When you start to look at your values, you can start to see a pattern between your emotions and your actions, right? That certain behaviors, if respect is an important value of mine, and I feel like I'm being disrespected, I'm probably going to behave in a certain way. I'm probably going to make certain decisions based on that. And it's important for me to understand that because maybe some of those behaviors that I demonstrate when I feel as though I'm being disrespected are not very productive. So aside from emotional intelligence, personality is another one. I use DISC quite a bit. And DISC looks at 4 different personality styles. And specifically, I work with DISC as it relates to conflict quite often, because what I have found in the organizations that I work with is that understanding our personality style from the standpoint of how we have conflict or how other personality styles might engage in conflict is really important in terms of being able to be effective at managing conflict. And we need conflict. Conflict is not a bad thing. It's that oftentimes we are experiencing conflict that's personal. We're hard on each other and not the problems. And conflict really is the effective or productive conflict is the opposite. It's really looking at what the issues are and being able to attack the issues aggressively and not each other. Now, the next component of what I work from is this model called cables. And these are based on 6 behaviors that are about creating stronger relationships. And each one of these are based on a fair amount of research as to why this behavior is important. So when we look at some of these on this list, right, I will oftentimes go back to an organization's values, the stated values of the organization. Because if we think about this, right, the first 2, turn your back on somebody else when they're talking to you or hanging up on them, it lacks respect. So from an organizational standpoint, I often find that, one of the values within an organization is around respect or collaboration. So we're not even in line with what our values state or what the organization says their values are, which I think is really important for an organization to follow through. You got to walk the talk. If our values are around collaboration and accountability and respect, then as an organization, we need to hold each other to that from the top all the way to the bottom, making sure that people do that, right? Appreciation is the A in that cables model. And that's recognizing people for who they are and what they do. So when we talk about, one of the disruptive behaviors on here was around saying things that are making comments that are derogatory or, you know, looking at, things that are disrespectful to somebody's race or their religion, or their ethnic background. We're not appreciating people for who they are, right? We hear so much today about diversity, equity, and inclusion. Well, we need to demonstrate appreciation. When we do that, we're able to effectively address that. Belonging is the next one, is the B in that model. And when we're creating a sense of inclusion, belongingness, many of these things that we're talking about here are addressed, right? We're certainly not bullying people if we're trying to have them feel as though they're included in what we're doing, right? We don't do that to people. We don't turn our backs on them if we're trying to create an environment of belonging. We just don't do that. The next one is around listening. That's the L cable in that cables model, which I talk about in terms of listening 4 different ways, right? Listening with our eyes, listening with our ears, listening with our mind, and listening with our heart. And when we listen in that way, we're not in a place where we're going to turn our back to somebody or hang up on them, because we're invested in listening to what they're doing. Empathy is the next one. That's the E in the cables model. And that really is about treating people the way we want to be treated, right? When we think about many of these, right? Showing physical aggression towards somebody else, or trying to publicly humiliate somebody, or turning our back to somebody, or hanging up on them. If we think about this, is that how I'd want to be treated? Probably not. So from a standpoint of empathy, we're trying to treat other people the way we'd like to be treated ourselves. And then lastly, in this cables model, it's around specifics, clear expectations, right? And from an organizational standpoint, what do we stand for? So important here. In organizations, it's probably something that I see most often when there are problems within an organization, is there aren't clear expectations. We don't really know what is accepted and what isn't accepted, or at least they're not put out there in a way that people recognize them. The other part of this is maybe they are clearly stated, but people aren't held accountable to them. There's no ownership for these things. Then equally, that can be as devastating or damaging to an organization, because what it tells people is we don't really stay congruent, which is that first behavior that I talk about in cables, to what we say our values are. We don't walk the talk. We talk about respect in our values, but people here don't respect each other. There's a lot of disrespect that goes on. We talk about compassion in our values. I don't feel that there's much compassion that happens in this organization. We talk about integrity, the behaviors that I'm seeing, backbiting or gossiping behind people's backs, or trying to humiliate people when they're not, when they're not there to make them look bad. That lacks integrity, right? We're not walking the talk when we say these are our values, but we don't live by them. So we can see that this study, this piece of research that was put out over a year ago, has so much value, but very few have really, I think, taken a look at this to say, here's a way that we can start to look in our own organization. How do we create an environment where we're dealing with things like burnout, and we're positively looking at how do we improve our patient safety here, and prevent poor teamwork. All of those things are identified there, and there are behaviors and ways that we can change the course that things have gone on. So I hope you have found this valuable. And as I mentioned, I'll have the link to this study in the comments section, so that you'll be able to go and reference it as well if you want. And until the next LinkedIn Live, I hope you're able to go out there and rise above your best.